Hi everyone, I'm Dr. Mandi McCoy. It has come to our attention that many of you don't know that we can actually treat babies and children in our office here at Drummond Chiropractic. Babies are actually my favorite thing to treat because they're so adorable. If you can look here, this is all the actual things that we treat. This is just for babies, so there are more as children grow, but just for right now, we're just going to discuss what we treat with babies. As far as how we treat them, we start with just kind of a consult with the mom or dad if the dad's with them. We discuss the birth, whether it was C-section, vaginal, if there was any interventions, and then we kind of just go over how baby's been since the birth. Whether they've had difficulty latching, issues with bowel or bladder, if they have trouble sleeping, prefer like one breast over the other if you are breastfeeding or if you're bottle feeding. And then we kind of discuss mother's diet as well because that can affect a lot of these areas. So as far as the exam goes, it won't really look like we're doing too much because I'll basically just be holding your baby, but babies are so young and their bones are so pliable at that time that it just takes a little bit of pressure, and that's all I need to kind of feel, make sure the motion's there, mobility's there. So like I said, it doesn't look like I do too much, but I'm actually examining them as I'm holding them, okay? We can also have the mother lay down. If baby's kind of a little fussy, we'll lay them on the mother's belly just so they get that comfort of being with the mom, and we can do the exam that way as well. So these are the different areas that we do treat, or these are at least the most common that we see in our office. And like I said, the same with the exam is it's not gonna look like that much that we're doing. Like as far as ear infections, like we might give a little bit of tug on the ear. It's not gonna be anything drastic. It's gonna be very, very gentle to kind of realign that eustachian tube of their ear. And then as far as the other ones, when it actually comes to adjusting the baby, it's not like you would see with a normal adult where we put a lot of pressure on them. If you can even imagine putting your finger on your eye, the littlest pressure that you feel when you do that, that's as much as we do, because again, they don't need that much at this age. But again, here are the couple different things that we treat. Like I talked about for ear infections, we usually look kind of in the neck and look at the ears, kind of give them a little bit of a tug. Same with tonsillitis, we give the ears a tug. We look a lot with jaws. Babies do have jaw issues, which is kind of weird to think of, but they can. And then we work on draining out of the throat as well. Now, all of these, I'm going to talk about the areas that we do look at, but we also do full body because it could be something from like tonsils that's coming from the pelvis, because you just never know with babies. Now with colic, the medical definition of colic has to do with like stomach issues, digestion issues, irritation there. Now for when we think chiropractic wise with colic, we think of a couple of different things. The one area we focus on looking at for colic is the neck. So a lot of the times with colic, babies are crying and they're in pain or discomfort somewhere and they just can't tell you at that age. So we look at the neck because how traumatic the birthing process can be, because if you've ever watched a birthing video, they have to use that head to kind of wiggle their shoulders out. So we look at the neck for that. We also look at, mom's diet, anything that could be disrupting bowel or bladder, because that can also cause irritation to the baby. And again, they don't know how to tell you that they're irritated. As far as constipation, acid reflux, again, we look at the mom's diet, we look at the mid-back, we look at the pelvis, just because any of those little things, and it doesn't take a lot for babies because they're just their bodies aren't used to it yet, that it's a little pressure and a littlest thing can be off and can be causing all of these issues. Now when we're looking at nursing difficulties, this could have a lot of things that can go into it. The first thing we look at is the motion of the neck. Do they prefer one breast over the other? If they do, it might be that they can't turn their head to the left compared to the right. The next thing we look at is actually the baby's mouth. So during the exam, I'll actually put on a glove and stick my finger in their mouth to check their suck, make sure it's nice and strong. We check their upper palate, make sure it's equal on both sides. We check their jaw. So all these can again factor in. They could have like a lip tie, tongue tie, which we can help relax the muscles as far as that goes. Again, we look at mom's diet in this because whatever mom eats, if you're breastfeeding, baby eats. So baby might not like whatever it is that mom's eating, so we evaluate her diet as well. Now when it comes to injuries, torticollis is a fancy name for like wry neck. So if you have ever seen a child that's kind of tilting to one side and they just can't go the opposite side, that's basically what torticollis is. So as far as injuries, that could be from a fall, that could be from a car accident, because babies can get whiplash too. Like their head does go forward and backward just like an adult's does. So we look at a lot of different areas for that as well. Another thing we look at as babies kind of grow and go is asymmetries in their body. So when baby starts to sit up, or when baby starts to roll over or crawl or walk, we want to make sure that if they're rolling over, they like going to the right as much as they go to the left. Or when they crawl, their legs are even on both sides, because this is when they're starting to develop those habits. And if they're asymmetrical, eventually it's going to lead to problems. So we want to catch it in the beginning, fix them there so they don't have problems in the future. So hopefully this talk helped you and calmed any of your fears that you had about bringing your child in. And you can just simply bring them in for an evaluation, and I'll tell you if they don't need anything, because a lot of the time, thankfully, babies don't need anything. They'll kind of fix themselves, but sometimes they need that little extra oomph to kind of help move things along as they should. If you have any questions, you can give us a call at the office. If anything else, just bring in your baby.